how a pregnant woman can actually take care of her kidneys. Okay, I know that you've seen a lot of pregnant women coming down with kidney issues, either during the course of their pregnancy or after giving birth to a child. So in this video, I want to talk to us about how a pregnant woman can actually take care of her kidneys so that she wouldn't be needing dialysis. Okay, so that she won't have AKI, so that she will give birth to her baby, mother will be alive, child will be alive, father will be happy, everyone will be happy. So in this video, we're going to be looking at things that you need to do to be able to achieve that. And number one thing we'll be looking at is hydration. Okay, someone say hydration, hydration. If you've been watching my video, you will discover that hydration is one of the things, no matter what I discuss, I actually find a way to bring hydration into our discourse, because hydration is actually very, very important, that the importance cannot be overemphasized. In fact, if I've created a video where I discuss how to drink water. So if you've not watched that video, I want you to click on this channel and scroll down. You will see the video where I talked about how to drink water, so you know how to drink water properly. So for a pregnant woman, you need to hydrate properly, because as your pregnancy increases, you discover that you urinate frequently. You need to replace the water, and this time around you're not drinking for one, you're drinking for two. Okay, so you need to be able to drink enough water so that both urinary tract infection wouldn't set in, because pregnant women are also predisposed to developing urinary tract infection, and this urinary tract infection, if not properly handled, can ascend. That means they can actually go up, causing kidney infection. I know what kidney infection means. Kidney infection would now be causing back pain. This person may think it's labor pain or mistake it for any other thing. Having back pain when it's not yet time for you to experience all those things. You know what I'm talking about. So this person begin to feel those back pain all in those places because of a urinary tract infection that have ascended into the kidney. So if you're hydrating properly, it will be able to help you to stop these things from coming up, so you'll be safe. So as a pregnant woman, what I'm saying right now is that it is actually very important for you to do what? To hydrate properly. Number two thing I'm going to tell you is about diet, diet, diet. As a pregnant woman, you need to watch your diet. I know we have what we call craving for pregnant women. It's actually very, very okay. But as a pregnant woman, you need to make sure that you're eating for two, and you're eating what you need to eat. Okay, so we also recommend that eating fruits is actually very, very okay for pregnant women. You can eat fruits, you can eat vegetables. Okay, these are food that are easily digestible, and that your kidneys can actually remove waste products from almost immediately. So we also talked about to pregnant women to reduce salt, reduce salt intake, because when you take a lot of salt, it's actually going to help. It actually has a way of predisposing you to having high blood pressure. I know that high blood pressure is not actually good for a pregnant woman. Even as the pregnancy advances, it can actually affect the cause preterm delivery and cause a lot of other things. Okay, it's also very important that we now talk about um, how other things, okay, that you need to do to be able to maintain healthy kidney. And one of the things that you need to do to maintain healthy kidney is to take your antenatal serious. Someone called me a few days ago and was telling me I'm pregnant. I just noticed I'm pregnant. So when should I visit? When should I start my antenatal? Okay, I told the person that you need to start your antenatal immediately. So if you're here and you're pregnant, and you're watching this video either on YouTube, TikTok, or Facebook, anywhere you're watching this video from, I want to tell you that it's actually very, very important that immediately you notice that you're pregnant, that you begin your antenatal care. Antenatal care is not a place where you spend money. Okay, don't look at it as a money spending venture. It's actually a life saving venture. It's actually a place where you go to, the doctor look at you and be able to tell you things about your health. There are issues that become issues that matters that would have actually been detected earlier if you started your antenatal very, very early. That if you don't actually start it very early, it may be detected late, and helping you may become difficult. A lot of women develop what they call preeclampsia and even eclampsia, and these conditions are very, very serious conditions that can affect both the child and also the mother. So that if that condition is not properly handled, it can lead to death of both or even one of them. So remember that the aim of this pregnancy is to have what? A healthy mother and healthy father and healthy baby. Okay, so what you need to do is to do what? Take your antenatal distance serious. Don't miss your antenatal. Okay, if by adventure you missed it because of work or something else, make sure you report to your doctor, your midwife who actually looks at you, and also make sure that everything is actually safe. Okay, so you also need to manage your blood pressure very well. If you have high blood pressure already, okay, let's say you as a pregnant woman you have high blood pressure either before or during the pregnancy. During pregnancy it means that there's a condition that is underlying, or pregnancy triggers the high blood pressure. You need to make sure that you take your blood pressure management very, very serious. Okay, we talked about preeclampsia. We also talked about that pregnancy, high blood pressure can actually affect pregnancy very, very well. Okay, so that is also going to something that you also need to look into. Then, as a pregnant woman, what you need to do is to avoid you need to do is to avoid self-medication. I know this might actually not be your first pregnancy. This might actually not be your third pregnancy, and you've taken routine drugs, or you've taken the routine drugs. You know what to expect when you have malaria. You know what to take. You know. Some people even go as far as using certain native medications on their own without being a licensed herbal doctor or whatever. So they know how they go into the bush and get one or two things for themselves. So the truth is that most of those things, by the time you take them without proper guidance, they have a way of affecting you. So as a pregnant woman, make sure you get advice from your doctor, or whichever way you want to go. Make sure you get get your advice from experts, someone who is actually seasoned in that field to actually guide you. So if you're doing self-medication, maybe you're having pain as a pregnant woman and you're taking NSAIDs, it's called that you're doing yourself more harm than good. Okay, so, and there are also medications that you would take at that point when you're pregnant, both be it herbal, be it orthodox medication, that's normal medication, normal drugs are given in the hospital. That if you take them in abusive dimension, it will hamper, it will affect the baby. So you need to have a baby that will come out in this world, in this life, and will be able to thrive without assistance, to thrive on their own. So as a pregnant woman, another thing that you need to do is to get enough rest. Rest is actually something that is actually very, very important for everybody. But as a pregnant woman, you need to get rest. I know you work. The dynamics of womanhood have actually changed over the years. That women now work, unlike the way it was for our mothers, who were mostly sit at home mom. Now we have women working and all the rest of them. As a pregnant woman, you need to, as your pregnancy advances, you need to get more time for rest. As you're doing that, it's also impacting your kidneys and all the rest of them. So this is where I'm going to be drawing the curtain close. If you know a pregnant woman, please, I want you to share this video with them and help someone today. Thank you. I'm Monovo Victory, and I'm your kidney health coach. And before you go, I have a book I have written on preventing kidney failure in women. It's titled "Stop Kidney Failure in Women." I'll be dropping the link to that ebook on the comment section to this video if you're watching on Facebook or on YouTube. So you can actually go there and download the book and familiarize yourself with other things that you need to know as a pregnant woman to safeguard your kidneys. Thanks so much for watching.